Assalamu alaikum everyone. Welcome to VR Duchess. Today we are going to demonstrate the step of sculpting in phaco surgery. Before proceeding to phaco, regardless of which technique you are using, we usually try to remove the cortex and epinucleus in the superficial area of the capsular bag. This creates a new circular area resembling the capsular rhexis, like a pseudorhexis, so you can work more comfortable within it. It also gives you a more accurate estimation of the nucleus size, allowing you to estimate the sculpting depth accurately without applying excessive force. Sculpting depends on the concept of cavitation. The ultrasound wave energy works within the nucleus and propagates towards the periphery. Note that the force should not come from your hand mechanically. You simply move forward gently while the ultrasound energy is eating through the center of the nucleus. So, where should the movement come from? The movement should mainly come from your fingers, with minimal movement from wrist joint. No movement should originate from the shoulder or the elbow joints. Now we can observe how when the movement comes from an elbow or shoulder, it causes aggressive globe movement and requires excessive force to perform sculpting. This resembles a writing technique. On the other hand, the correct method is more like a drawing technique, where the movement mainly comes from your fingers, with minimal wrist movement and absolutely no movement from the shoulder or elbow. This generates a fine, gentle sculpting with no excessive force applied. Next, let's discuss the power used during sculpting. If you use too much power, the cavitation effect of the ultrasound propagates too rapidly, resulting in a tunnel that is too wide and non-coaptive, making cracking difficult. On the other hand, if you use less power than required, you will create an insufficient or narrow tunnel, requiring you to apply excessive force to crack the nucleus, resulting in uneven and difficult crack. Many surgeons overthink the curved movement during sculpting in an attempt to go deeper centrally. Actually, a straight line sculpt can achieve the same goal effectively. Sometimes, overdoing the curvature creates a very deep proximal tunnel and a shallow distal tunnel. An uneven tunnel leads to an uneven crack. The crack itself should be a quick side kick, not a pulling movement. After completing the sculpting, you should check the red reflex changes, side wall estimation, and phaco depth estimation. Then place the instruments inside the crack, and with a quick kick or click movement, the crack will occur. If you observe the surgeon's hands carefully, you will notice very minimal movement during cracking. Aggressive pulling movements result in excessive rotational movement of the nucleus without generating effective cracking force. In such cases, you can see increased stress on the zonules and excessive pressure on the globe. Positioning also makes a significant difference. You must place the instrument deep enough. Otherwise, you may end up with unequal crack. For example, when the chopper is positioned too low while the phaco tip is too high, like in this case, or you may fail the crack because both instruments are too superficial, forcing you to apply unneeded excessive force. Remember, cracking is a side kick, not a pulling action. Just a quick lateral kick is enough to crack the primary tunnel or any tunnel you create. No matter how small the tunnel is, you can successfully crack it if you respect the correct position and direction of the movement. Thanks for watching.